Well, ladies and gentlemen, welcome back, and we still at Nile TV International, today's edition of Cairo Local Time. And as we, of course, talked about the Egyptian-Algerian Forum, and as you watched the report concerning the sixth forum of the General Authority for the Healthcare Authority today, under the patronage of His Excellency Prime Minister Dr. Mustafa Madbouli, and as Egypt has inaugurated the 6th annual forum of the General Authority for the Healthcare Organization and the Healthcare Network, which Egypt started to implement and to develop years ago, starting from the first phase, and now we are approaching the second phase, improving the network of the healthcare and all the conditions of the most of the hospitals and the cadres and the medical cadres, etc. Well, to shed more light on this, on the improvements took place and implemented on the ground concerning or within the framework of the healthcare system and organization in Egypt, we are delighted to be joined over the phone by Dr. Jamila Nasr, the head of cardiology department. Dr. Jamila, great pleasure having you with us.
Hello, it's my honor to be with you, and I'm very happy to share with you this great news as the Egypt's Prime Minister Mustafa Madbouli attended the 6th annual forum of the Egyptian Healthcare Authority today. This is marking 6 years since President Abdel Fattah al-Sisi had launched the country's universal health insurance program in Port Said.
Yes.
Actually, it's a two-day event under the theme From Vision to Expansion, elevating health care to global standards, and highlights the achievements in health and reform and the completion of the program's first phase, as you said, across 6-year governorate, serving over around 6 million beneficiaries. So this is very excellent news.
Of course. Yes, doctor, we're talking about, I mean, the healthcare insurance was such a great dream which came true finally after long years. All of us, I mean, who even go abroad and watches or enjoys the healthcare insurance everywhere. And even we are hearing about, we got dreamed that we enjoy here in Egypt such medical insurance or healthcare insurance. Now the dream came true. How you find, and what's the best ever conditions of the best healthcare system, your point of view first of all?
Oh yes, we're very lucky to witness this great achievement in the health system in Egypt, and of course it improves the health care and the coverage to all the Egyptians Egypt-wide, and also it improves the skills of the medical staff and administrative staff as well, sharing international local practices, preparing the healthcare system for future expansion. So this very good news. Also, there is a competition between different, medical complexes, and I'm very happy to announce that Ismailia Medical Complex today was nominated to be the best hospital in the whole first phase.
Ismailia and Port Said as well, I think, yes?
Yeah, they started in Port Said, but today, the year 2025, nominated hospital to be the first and the best hospital all over the governorate today is Ismailia Medical Complex. So this is congratulations to these, and of course this was started in Port Said years ago, and this is the first governorate to have this great achievements. So I think, as you have said, it's a big event, and also there are signing of many cooperation agreements with leading healthcare companies today, in NGOs and international institutions. Screening of
private sector as well, of course.
Yes. And I think we're very happy to have this great event, and I think, as you can see, it's a big step, as we know that long ago, the system was covering around 58% of the Egyptians, but the health insurance really will be covering the whole Egyptians. So this is a great achievement, as we can see.
Yeah. Dr. Jamila, when we talk about story of success ending many chronic diseases like virus C, like many others, ending the waiting lists, actually setting the citizen or the Egyptian citizen as a priority on the developmental agenda of the country now, or of the Egyptian state now. So how you even can identify this while we are talking about reducing the poverty rates and reducing the waiting lists, ending the suffering of the Egyptian patients through improving and implementing the infrastructure of all the hospitals within the framework of this healthcare system?
Actually, it's a big step, and as we know that the chronic disease, as you have mentioned, is the cause of death in about 85% of the Egyptians, and we can see now that the health areas are a priority, and we can see that there is a high impact strategies, which is in the form of prevention, like the lifestyle, early detection, screening, periodic screening, strengthening primary health care, health workforce development, digital transformation, public health and environment, road safety as well, measurable 2030 targets. So I think there's a big achievement in the view how Egypt prioritized the health as a real important step to take care of Egyptians. So I think we are in an era where, as you have witnessed, there is 100 million. It was a very amazing screening job for all Egyptians. So this is one of the way the government is taking care of the Egyptians' health, and there is community engagement, there is partnership with universities, there is a strong political commitment, there is continuous monitoring, transparent reporting. So I do think that we do have measurable 2030 targets to decrease the 25% cardiovascular mortality, to decrease 30% smoking prevalence, to decrease 20% obesity rates in adults, to achieve 90% or more coverage for essential screening programs, and maybe so this is really very important. I think we are on the right way, and Egypt is on its right way.
Yeah. How essential is to get benefit under the universal healthcare system? Your point of view, digitalized one, using and applying the latest technologies in all the healthcare centers and hospitals, and on the infrastructure of such. How you find it so essential?
It's so essential. I'll tell you something. A universal health system ensures that every person receives essential quality health care without, financial hardship. This is very important, regardless of income, regardless of age, employment, geographic location. And everyone is covered, so no discrimination. It includes prevention, curative rehabilitation, palliative services. It means equity, and that people with equal needs receive equal care. Resources are distributed fairly across the regions and the population. There is also financial protection. No one becomes poor because of illness. Eliminates the catastrophic out-of-pocket spending, the quality of care, of course. So I think this is very important. And, as you can see, we are in the era of electronic and the era of medicine, which is dependent on digital transformation, yes, as you have said. We do have a total change regarding the electronic health records. And this is very important because when you have a good or feasible electronic health records, you are sure that you will have a good quality for health services. You do have mobile applications, maybe for medications adherence, for labs, for imaging results, for appointment systems. So this is very a huge step in the field of the healthcare system. So I think we are in the right way. And I think that we are, you know, Egypt is on its right way. And I suppose that the health systems, you know, there is, you know, it's the key building blocks of our Egyptian universal health coverage is the strong primary care, the gatekeeper system, family medicine at the core, comprehensive benefits package, clear list of services guaranteed to all citizens, efficient hospitals, referral pathways, performance-based management, health workforce development, sufficient doctors, nurses, very qualified, paramedics, training, licensing, continuous education, reliable financing, digital health, as you have said, infrastructure, national databases, telemedicine, governance and accountability. So I think we are witnessing the benefits of a universal health system, reduced mortality, longer life expectancy. You know, the Egyptian life expectancy now is around 76 years for females and around 73 for males. So this is very, it's longer than before.
Yeah,
there is a higher productivity and economic growth. There is lower financial burden on families because we can do even, you know, I'm a professor of cardiology. I'm the head of cardiology department at the Ismailia Medical Complex and the Universal, you know, this is, I say that some operations or not operations, intervention like the TAVI, for example. This is the transcatheter aorta application by using a very simple technique. It costs a lot if you compare it with a surgical interference for a patient. Maybe this is much different, and I think the people can pay much less money, and the Egyptian health system covers around maybe more than 600,000 Egyptian pounds for this intervention. So this is a better health equity, which is very important. And of course, I think this is funding sustainability. There is funding sustainability. And we have, again, higher productivity and economic growth. This is very important. And as I've said, there is lower financial burden on families.
Of course, and we are supposed to be on the right track, really on the right track. And coming back to the theme of this year's annual, of the 6th annual forum this year, vigilance, and from vigilance to expansion. And as we are at the end of the phase 1, moving on and progressing, moving on to phase 2, how you evaluate the current progress of Egypt's universal healthcare system rolling out as it expands to the other governorates?
Yes, of course we have gained a lot of experience, and in the first phase, maybe the second phase will be more efficient, maybe more easily applied. We do have a lot of, there's so it was a simple strategic roadmap, and I think Egypt never had started with a clear vision. And we should ask ourselves that what future do we want to create, who benefits, and what are the measurable impacts in the coming years. So this is very important. And you translate the vision into the strategic pillars, quality improvement, workforce development, of course. So I think we are on the right way. We are doing capacity expansion, more staff, equipment, clinics, beds, technology, operational expansion, partnership expansion. So I think we are on the, so it's the first phase, just help to create an implementation roadmap.
Yeah.
You know, so I think that we now, after the first phase, we built a monitoring evaluation system. We used the KPIs as the coverage rate, the quality indicators, the patient satisfaction, customer satisfaction is very important, the workforce productivity, the financial KPIs. Maybe you should make decision in the second, step based on data, not a guesswork.
Yeah, of course, and scientific steps and the careful implementation of such strategic plan, moving on from vision to expansion, it's really so essential and crucial in such a phase, and especially when we are really approaching tangible results on the ground. Dr. Jamila Nasr, head of the cardiology department, many thanks for your insights and for being with us.
Thank you very much. Nice having.
Have a nice evening. Thank you. Well, ladies and gentlemen, as Egypt now is really working on investing in the Egyptian citizen and setting the Egyptian citizen on the top of the priorities of the country. Now we are talking about the health side. Of course, we are talking about the main two pillars, health and education. And moving now from the healthcare system and the improvements on the healthcare system to the education and the improvements also and developments on the education system, as Egypt also and Italy have taken major steps in strengthening their educational cooperation by signing agreements to establish 98 new applied technological schools across multiple fields. And of course, this is within the framework to increase the number of the vocational educational schools. This is within the framework as well with international institutions, other European countries like Italy, Germany. Yesterday was also another forum with Germany. And the move signals a broader partnership aims at elevating technical education to international standards and supporting Egypt's future workforce, special for or to approach the Egypt's vision of 2030. This will be only through having very professional calibers coming out of technical or technological applied vocational schools. Let's watch.
Egypt and Italy signed a series of cooperation protocols on Tuesday to establish 89 new applied technology schools in a range of specializations in a ceremony attended by Prime Minister Mustafa Madbouli. The agreements were signed by the Ministry of Education and Technical Education alongside several ministries, national bodies and private sector partners, as well as a group of Italian technical institutes and academies. Cabinet spokesperson Mohammed El-Homousani said the protocols aim to set up the new schools in line with international standards. Participating ministries include Agriculture and Land Reclamation, Water Resources and Irrigation, and the Ministry of Public Business Sector, represented by several of its major holding companies. Other partners include several national development bodies, industrial institutions, and technical training organizations. The initiative is also supported by multiple Italian educational, technological, and industry-focused institutions that contribute expertise in areas such as sustainable development, advanced manufacturing, and vocational training. Speaking at the signing, Madbouli said the initiative reflects the depth of Egyptian-Italian cooperation and marks the start of a new phase of partnership on technical education. He said the expansion of applied technology schools is central to the government's goal of building a more competitive knowledge-based economy. Education Minister Mohammed Abdul Latif said the agreement represents a significant step for technical education sector, citing Italy's long-standing expertise. He added that the partnership focuses on quality assurance, skills development, and aligning training with the needs of both domestic and international labor markets.